Good afternoon after the live surgery. Now I will be showing the bone saw model demonstration. Uh, Dr. Saha in a complication very well said that you must take care of prevent the hinge fracture. Right, sir? So usually I don't do in the patient, but in this saw bone, I have to fix on the lateral side because this is a fragile bone and it can break when I do the osteotomy. But even in patient, it can be done as a safety point of view to prevent the hinge fracture. First, I will fix a wire on the lateral side. इसको चलाओ. Foot या तो foot wrist वो हमको दे दो आप. You give it to me. Open कीजिए. So I have put an wire from lateral side to prevent the hinge fracture. First, before starting the operation, what I do, I put this plate on the skin and I will mark. There are three holes in the plate. Upper hole is here, middle hole is here, and the lower hole is here. The upper hole, if you put a K wire in this will tell you the upper limit of the plate. And when you put a second K wire in the middle hole, put it parallel and make it 45-degree angle. This will show you the osteotomy line. And the third hole is to fix the, this is the lower limit of the plate. So just to see the upper limit of the plate, that it is just 5 centimeter below the joint line. And if that K wire passes below the joint line, that means that all the screws which are parallel will be in the bone, not into the joint. So after seeing the upper limit of the plate, a curved incision is given here, and after the incision, I reflect the periosteum from the upper portion and from the lower portion of the tibia, so that I can put my finger under the surface of the tibia, proximal part, so that you can feel the lower under surface of the tibia. And after reflecting the periosteum, upper side and the lower side, I will put two parallel K wires. Wire लगाइए, aiming towards the tip of the head of the fibula, and it will be at the 45-degree angle. And both the K wires, it should be parallel to each other. So suppose this is the area, and yes, this is the first wire. This is at the 45-degree angle, aiming towards the head of the fibula. ये अंदर जा रहा है, ये नहीं चलता है. Now stop. Now you can see this wire coming from this side. Open it. This wire comes at 45-degree angle towards the tip of the head of the fibula. Right? This is one K wire, and after that I will put another K wire parallel to this. Then another K wire parallel to this. Yes. यार टाइट करो यार. टाइट करो. चाबी इसकी है ही नहीं है. ये इसकी चाबी है नहीं है. Okay, do it. Stop, open it. Now you can see these are the two K wires. They have come at the same point. They are parallel to each other, right? Is it visible? Okay. Open it. After this, we will do the osteotomy. For the osteotomy, as Dr. Saha, I took your lecture very seriously, and very importantly, he said that there are chances of vascular damage. So what I do, that when I reflect all the periosteum from the under surface of the tibia, I put a mob under the surface of the tibia up to the lateral end. And over the mob, I put reamers, bone levers, homens, so that, and bend your knee to 50 to 60 degrees, so that all the neurovascular structures, they are down and they are under cover of the mob. So you can prevent that neurovascular damage. So after bending the knee joint, I will start the osteotomy. Start the osteotomy below the wire. Never start osteotomy, never do osteotomy above the wire, because if your hand starts shaking, you can go into the joint. So start with the, yes, start below the K wire. Start, yeah. Yes. Yes. सब खुल गया. So when I reach up to the level of the just above the tibial tuberosity, I stop with the motorized instrument. Then I use the osteotome, and with the osteotome, it is very important. Then you just hammer 3-4 times and take it out. Then another osteotome 3-4 times, take it out, and it should go gradually, not with a hard stuck. And gradually with one osteotome, then enter second osteotome, third osteotome. So the osteotomy gradually increases, and you get a, इसका स्पैनर भी नहीं है, अब तो ये हो गया, leave it, you give me the osteotome. फिर खुल रहा है, छोड़ दीजिए, osteotome. So after doing the motorized osteotomy, I will just do a 2-3 hammer, and I will take it out. One precaution is very necessary, that while working with the osteotome, never move your hand up and down, otherwise you will get an intra-articular fracture. So वो सर उसका वो नहीं है. This is जुगाड़, right? चलो. करो. कोई बात नहीं, छोड़ दो, बस लाओ दो osteotome. Then I will introduce osteotome like this. Then another osteotome. Over it. थोड़ा open करो. Like this. And after that, the another number, and gradually the osteotomy will open with the, like this. It is a fragile bone, it has come out. So after hitting with the osteotome, the osteotomy is opened. Now you can see The osteotomy is opened. Then take the block, give me the block. Then I will, I will open the osteotomy and I will put the block and see the correction after putting this block. If it is kept horizontally, it will correct 8 mm. Make it vertical, it will correct 10 mm. Now another block, there are 4 blocks. So by which block the deformity is corrected, that block is attached to the plate and then plate was slide down, take out the block,
Isn't it easier to keep that expander inside the osteotomy?
yeah, yes, yes.
I asked the same thing him, but the point is this, he said if it misses and goes inside, then it becomes difficult to take it out.
No, he is saying about the spreader. He is saying about the spreader. That what we did in the live surgery. We did in the live surgery, yes. This actually, yes, you can just put a spreader and see the correction of the deformity. Yeah. But instead of doing this, I put block. Block will hold everything.
Yeah, you don't use it.
No, I don't use it. Then I will slide the plate. Block will be at the side like this.
Okay.
Right. Now you see that block is inside the bone and deformity is corrected. Then you have to fill all these screws. If bone is away from the plate is away from the bone, then you hold the plate with the bone clamp and just insert a cortical screw, fix all these locking screws, and in the last take out that cortical screw and replace it with the locking screw. So there are 4 blocks of different sizes, 4 mm, 6 mm, 6 mm, 8 mm, 8, 10, 10, 12. If you place this horizontally, it will be 6 mm, make it vertical, it will be. So, sleeve, or drill and sleeve. Drill. Hold it properly. ऐसे hold करो. दबाओ. चलाओ. लॉकिंग स्क्रू कोई भी दो. लॉकिंग दिस इज द लॉकिंग. खोलो. इसमें तो चला ही जाएगा. पकड़े रहना. यहाँ इस पे लग रहा है, इस पे लग रहा है. छोटा है, छोटा है, छोटा नहीं है, कोई बात नहीं. ठीक ठीक ठीक. चलो ड्रिल. ये भी पूरा नहीं जाएगा, बट ठीक है. हाँ, इट विल नॉट गुड. चलो एंड ये इसका स्लीव दो, छोटा वाला स्लीव दो, स्लीव यार ऐसे दो, तुम स्क्रू दो, कोई है स्क्रू? चलो प्रेस, दबाओ पैर से, पैर से दबाओ, छोटा स्क्रू दो, कोई भी, कोई भी दे दो। चलो 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 चलो, एक इधर के लिए दे दो। स्लीव है? हाँ, इसी में होगा, लो दबाओ, ये दे दो। ठीक, okay. Now I will show you the fixation, that these are the parallel screws at the upper end. They are all below the joint line. This is a 45-degree angled screw which works as a beam for this column, which helps in weight bearing. And this bending also supports the proximal tibia for the proper weight bearing. That block is placed at the cortex, that also helps in weight bearing. Now you can see that the fixation has been done.
You mean to say, sir, the bend finishes at the osteotomy level?
No, above the osteotomy level, just above the osteotomy, because there is this is 45-degree angle.
My question is, sir,
Yeah,
the bend when it finishes and becomes the straight plane, that is the level of your osteotomy?
not below that. Below that is the osteotomy level. You see it?